My approach to neurology is a systematic one that really starts with the patient and really understanding the patient from the biggest aspects of their life, where they come from, who they are, what kind of medical problems they have, but also to the smallest details and to the most subtle symptoms that they might be feeling. Neurological complaints are often extremely vague and hard to describe. When a patient is given a chance to completely tell their story in detail, often they give a lot of clues as to what's been going on that can help me as the physician to diagnose what's going on and help create a workup plan and a treatment plan. I think that the biggest key is really just listening to the patient and letting them guide how we work them up.
So my approach to neurology is really learning about my patients and letting them know that I'm going to be there by their side during every step of the process. Oftentimes in neurology, patients come in and the diagnosis is not really clear yet, and sometimes it takes a long time to really figure out what's going on. And that can be a really, really stressful time for patients and their families. And during that process, my goal is to really be there every step of the way and guide you through the diagnostic workup and keep you as functional as you can and living your life in the best way that you can while we figure it out.
I think my biggest strengths as a neurologist are that I don't come in with any preconceived notions, and I sort of allow the patient to give me what's the most important information to them, and I'll dig as needed into what they're asking me and give testing and provide diagnostic strategies. But I think when given the space to really delve into what's bothering them, what problems have been following them, and what they're suffering from, I'm able to really nail down how best to help. I'm a general neurologist, so I'm comfortable seeing patients who have issues with any part of the nervous system, whether it be cognitive concerns in the brain, weakness, numbness, seizures, trouble walking, and even to things that are in the peripheral nervous system or from the spinal cord, whether that be neuropathy or demyelinating disorders. My specialty is in epilepsy, so I'm an epilepsy and seizure specialist. I see people who have seizures and things that may be seizures, patients who have loss of consciousness, patients who have staring spells, patients who have attentional problems. I'm especially fascinated with patients who come and talk to me about any issues with consciousness or loss of consciousness or compromise to their consciousness or their thinking.
Some of my strengths as a neurologist is that I'm truly passionate about the subject matter. I've spent a lot of time learning and dedicating my time to understanding the brain and the nervous system. It's one of the most complicated and oftentimes confusing part of the human body, but at the same time it's really fascinating. And so I want my patients to know that I really love learning about the brain, and I will dedicate a lot of time trying to figure out how your nervous system and your brain works. Neurology is not clear cut, and it takes oftentimes months or years to sometimes figure out what's going on. And having a provider who really understands that and can guide you through that process, I think, is really important.
I welcome anyone who has any concerns with any part of the nervous system to come and see me, and together as a team we'll work through it. I've lived in the Massachusetts area for over 10 years now, and I'm new to Milford, but I've already fallen in love with the community here.
I love being at Milford Regional. I am a Massachusetts girl. I grew up right here in Central Mass in Shrewsbury. I was born and raised here and also spent a good chunk of my time in Boston. So overall, I know the community, and I'm really excited to just bring quality neurologic care to everyone who lives here and bring that Boston level care right here in Milford.
I think there's a misconception that high quality care and excellence in neurological care is restricted to large centers in big cities, and you have to go really far to get that. I have fallen in love with the Milford community, and in general my philosophy is that we can bring excellence in neurological care right next door, right where you live, make it accessible and be available for you, so you don't have to travel far and you never have to be too far from your doctor.